back to the theme of this section, which is the words that I use, which is hyper-personalization. I'm really excited by our next presenter. He is leading the charge to provide effective technology solutions for those with chronic disease, utilizing what they call micro-wearables and nano-diagnostics. So let's welcome IMEC's Chris Van Hoof to the stage. Thank you.
Thank you. Thank you. I left one buzzword out. In fact, we have a giga problem, a giga patient problem. And if you think about it, in Japan, 10% of the adult population lives with chronic disease. In Europe, it's 1 in 3 adults that suffer from 1 or more chronic illnesses. And in the United States, it's half of the adult population. So it is a giga problem. And for those patients, the proverbial an apple a day keeps the doctor away comes too late. And what we think is that in the future, maybe the app a day is going to go a long way in preventing hospitalization, in helping more personalized management of the disease. And what are those patients? Well, 26 million patients with heart failure. Fluid buildup in the lungs is one of the aggravations, one of the exacerbations. And today, this can only be tracked by thorax X-ray. So it means a hospital readmission. A wearable that could track fluid status would really help these patients. Or take the 100 million patients with sleep apnea. Many of them are not diagnosed. It's said that about 19 million Americans have sleep apnea but don't know about it. The diagnosis is in a sleep clinic, there are not enough beds. A home screening or diagnostic device would really make a difference. Or take the 174 million patients with chronic lung disorder, COPD. They need supplemental oxygen, but also they would benefit from a cardiopulmonary tool that gives real-time feedback and adjusts the treatment or warns about exacerbations. And finally, there's the 1 billion plus people with hypertension. Half of them have it managed. They're all at risk of developing cardiovascular disease. And what is worse, only 1 in 8 changes their lifestyle because this cuff-based spot check does not convince the patient. And so for all these patients, we are creating wearable solutions. Partly disposable, partly reusable, like this Band-Aid here. It tracks fluid status. We followed 100 patients with congestive heart failure and are able to track fluid buildup or the release of the fluid, both in the chest or in the legs. We're currently testing it for patients with COPD. And it becomes small and comfortable for outpatient use thanks to electronic innovation. Medical diagnostic system on chip creation. So you end up with a vital sign monitor in a cubic centimeter. And last month, we made that system even smaller. Now the whole functionality fits on a single chip. Medical system acquisition, signal processing, the memory, the security, communication. All you still need is a battery and you can fit it in a single-use disposable patch. Much more convenient for the user, but also a cost benefit. Now, apart from chronic disorder detection, we are also working on more acute detection, such as circulating tumor cell detection from single chips, or even peripheral or central nervous system recording, also using highly integrated systems on chip. And maybe this is a bit too close to comfort for many of you. I don't want that in my brain at the moment. If I can help it, then maybe this one works better. We are now able to detect electrocardiogram with full morphology while you're sitting in a car seat, also respiration, and through jacket, through shirt, through sweater. This goes a long way in increasing the comfort for the patient and enabling longitudinal recording. Now these these are solutions that are helping patients today and probably also tomorrow, and they are making a difference. Yet, we should also be thinking about the longer term. What about the next 10, 20 plus years? Especially because more than 60%, and in some regions of the world, over 75% of all deaths are caused by chronic disease. Yet, over 80% or about 80% of those diseases are linked to behavior and are in principle preventable. So that should be a big attention. And the good news is, and I'm happy to share it with you, we have the solution. And here it is. To prevent disease, all you need to do is lead an active life, eat a balanced diet, don't smoke, don't drink, and manage your stress. Bam, that's it. And well, I wasn't expecting applause for it, because we do know this already, and knowing the solution is obviously not enough. And for that reason, we are developing solutions, and I will share some examples. And is it a problem for the next generation? Let's look at some adolescent and young adult statistics. Well, too much salt, not enough fruit and veggies. Also, overweight due to lack of activity and due to the diet. And stress, a quarter of the young adults entering the workforce say they have very high stress, and 2/3 say they don't know how to manage it at all. And smoking and binge drinking are still problems. So their future is bleak. It's only a matter of time, and these young people are going to become older patients. And that is profoundly sad and really depressing, and that's why we need to change it. And we created a program that we call I Make I Change, to tackle just that, to help people stop smoking, stop drinking, balanced diet, losing weight. Or if you have a problem like burnout and you're in therapy, can we create tools for more personalized therapy to see the success, to witness the success of the therapy? So it's both preventive as well as therapeutic. Now, why is that difficult? Why is that a problem? Well, we are the problem. Because we're all different and unique. And while that's wonderful in daily life, it's a real challenge for the wearables and for the AI. And the uniqueness also means that we need to start creating unique, personalized apps instead of general apps. And to achieve a lasting behavior change, motivation alone does not work. Motivation is, of course, great. But it's now January 10th. How are your New Year's resolutions coming along? Motivation is not sufficient. To achieve lasting behavior change, you need to add the personal ability to change. How difficult is that goal for you? How difficult is it perceived by you? And that's completely different. And you need to add triggers. When and where should we motivate you? The right feedback at the right time. At this moment, I don't need advice because I cannot act upon it. Maybe afterwards or before. And most feedback today is rather kind. It's like a gentle coach. The virtual app feedback is very polite. It encourages. And this works for some. But behavior change is difficult. And I'm a rather stubborn person when it comes to changing behavior. This does not work for me. I need a drill sergeant in my app that tells me what to do. That may work. So also that needs to be acquired. What type of a person are you? What advice do you need? And for that, it's the proverbial carrot, the carrot versus the stick. You need to implement that in your wearable, in your app. And personalization today, this is me. This is hardly enough information to paint a good picture. So you need to do digital phenotyping. You need to add the wealth of information from your smartphone, from your wearables, to get a truly good picture of who you are, your habits, your cravings, Am I in the mood for a cigarette? Can we detect that? So to give advice really at the right time, not generic advice. That's what we're after. That's why we call it hyper-personalization. Feedback for you at the right time when you need it. It's like a digital fingerprint, a really good one. And to give you one example, I want to highlight our work on stress and stress management. It is a big health problem. It's a big societal problem. Yet stress management is rather elusive. We don't even have a sensor for mental stress. Today, it's being tracked by questionnaires, which are subjective, qualitative, and spot checks. Impossible to act upon in real time. So we set about changing that, or trying to change that. And we're conducting a large trial using investigational devices that we created, wristband-based, patch-based, and every information we can pull from the smartphone, together with experience sampling, with questionnaires, depression, anxiety, sleep, digestion, and so on. So we can indeed create personalized algorithms and compare them to the self-perception of the person. And we ran that trial. It's now completed. We ran that on 1,000 people from 11 companies. It's a large data set, and we have about 26,000 self-reported stress responses and about 120,000 hours of physiological stress-related data. It's longitudinal data, it's contextual, categoric, so time series versus non-time series. It's a large data set, and we are now starting to make sense of it. And it confirms what we know qualitatively. From this data set on 1,000 people, it follows that men express less stress than women. And this is the official stress and anxiety scale. Also from that data set of 1,000 people, we see that as soon as you do 1 or more hours of sports a week, you express a lot less stress. This is known qualitatively. This follows quantitatively from this large trial. But we're after more. We're after creating personalized algorithms. And so looking at over 20 features from these sensors, we do get personal biomarkers for stress, and we see that certain heart rate features are nicely proportional with a person's stress. Certain perspiration features are, same for skin temperature and so on. But they're not the same for everyone. For me, a different set of features applies than for you or for you. So we need a learning app that really adjusts and perfects itself to represent your mental stress. And we also add rich context because of the smartphone information we get. And we see, for example, this is probability of being stressed. People are most likely not stressed during lunch. They're more stressed in the morning at work than in the afternoon. And for this particular person, weekends were far less stressful than work weeks. You have to use this, of course, in your feedback as well. It's very rich information. Just relying on physiology is, first of all, not enough. And you have all of this to build upon. And if you do so, you can create a personal stress algorithm. And for example, we tracked somebody's week, stress during the whole week, and compared it during that trial with self-assessment of his or her own stress. And we see a very good correlation between what the algorithm says and what the person says. And maybe where there's a mismatch, maybe the algorithm is right and the person was subjective or didn't quite remember or couldn't quite picture his or her stress. We're now using this towards disease interception as well as towards management, personalized management, giving the right feedback at the right time. Similarly, we're starting a large trial on helping people with smoking cessation, exactly trying to capture, are you in the mood for a cigarette, so we can give feedback at the right time. We are having a hard time getting enough volunteers for this large-scale trial. Similarly, eating behavior and eating disorders, starting a large trial on that as well. It's another example of digital phenotyping and extreme personalization. What we think is that an app a day, technology and AI will really go a long way in creating behavioral technology and a long way in hopefully reducing the occurrence of chronic disease. It does not mean that an apple a day is bad advice. Please stick with that. If you want to hear more about it, visit our booth and hopefully enjoy a healthy lunch. Thank you.